vertical, right? And so as a result, right, even though it starts small down here, opens up as it comes to the sacral base, right, there's a clear anterior aspect and posterior aspect to the joint, right? And so, if I take the ASIS and I push it out, you're gonna gap that anterior aspect, but at the same time, I'm gonna compress the posterior. If I push the ASIS in, now I'm gapping that posterior, but I'm compressing that anterior. So you need to say ASIS so people know which direction you're pushing the ASIS to say, am I gapping one side versus the other? At the end of the day, does it matter? No, because you're looking, does it reproduce symptoms, right? And it's one of the tests, and if you get 3 of the tests, you win, right? If you get 0 of the tests, you also win, right? But, so you know what test was performed, right? So with that, let's get somebody up on the table.
I won't.
You can do it.
I
Oh.
don't want to be like a
All right.
sad day for me.
So, ASIS gap. ASIS tends to be either a ticklish area, right, or a pokey area for you to go in with. So as you do this, again, this is about handling, right? So what I typically say is don't just go for it, right? Find them first. When you find them, don't go poking. Utilize your thenar and hypothenaric methods, right? Kind of have a general sense of where it is, right? Ideally, even again, working with, we got clothes on, thinking about where the iliac crest is and where the 12th rib is, right? And I can just sink into that soft tissue right there in between the two. And so now, knowing where the iliac crest is, right, I can kind of shoot for ASIS right there. Right, so I haven't gone in pokey, right? And then all I need to do is just cross the hands from where I was, right? Then, being on top of the bone, right? Not necessarily on the inside, because if you're on the inside of the bone, then you're gonna pinch soft tissue between your hand and the bone, right? I'm going to drop my body weight down, which at the same time is pushing my arms in that direction, right? Which is gapping the anterior aspect, posterior, compressing the posterior, okay? There's that, okay? Compression, you can do in one of 2 ways, right? One is you can do the same thing, right? In this position, right? Supine, one side versus the other, and then squeeze. Right? You have to have the wingspan, right, to be able to get into that position and be able to do it. Which is why the alternative is flip on your side. With this, now the table as the force in one direction, right? You can come onto that ASIS, right? And it's pressing in that direction, right? So lateral, right? Or medial, I should say. Right? And you want to be on the ASIS, so that way you get that torque of compressing the anterior aspect and gapping the posterior. That's an alternate way of doing it. This way is easier because you can just put your body weight into it. Right? Downside is you gotta have a bigger foot.
And how wide?
Yes.
Are you pushing down this way or down?
I'm going down that way, so it's not straight down, it's at a slight angle. If you allow me to. So why do I not like this? Because I can do all of the tests except for one in supine, and then I can flip and do the one in prone, right? So instead of having the patient in 3 positions, I'd rather have 2. Personal preference. Either way, that's why I should both. Right? Okay, now the thigh thrust, the back of supine. This one a little trickier, right? Because it's about handling. All right, scoot towards me. So, with this, you should do the contralateral side. It is possible to do the ipsilateral side, it's just a pain to do, so do it on the contralateral side, then walk around. Right? I still do it that way, right? Even though you can choose, right? And there's a reason for it, direction of force. Because we think about where that joint line is, I'm trying to push through the hip to then push the ilium down towards the table. Right? So, we're going to take the contralateral knee, we're going to flex it up. Okay? Then from here, we're going to adduct to get the hip to come off the table. The caudal hand is now going to come underneath to block the sacrum. All right, and then from there, I'm going to drop my body weight through the thigh. All right, so I'm going in direction of the femur, and I add in a little stretch at the end. Okay. Looking for, again, all these are reproduction of symptoms. Right? But look at what I did there. Right? It was very strategic. Right? Strategery.
Coin it.
So as I come up here, right, I think about where I need my hand to come, right? If I start going in this direction, right?
No bueno.
Right? So if I flex up first, then adduct, now I can come around the outside and get my hand in. Right? Nice and easy. Right? The little things you don't think about until you make the mistake of going in the wrong way.
You're like, oh,
right? And then you get the patient.
Nice breeze.
So, thigh thrust. Right? Then Gaenslen's test, you got to do both ways. Right? And so the way that it's demonstrated in the picture, you take one leg, bring it down just so that the knee's hanging off so it maintains an extension. Then you flex the other hip up maximally. Right? Does that reproduce your symptoms? And then you go the other way, right? Because what are we doing? And this, because of the attachment of the rectus, as you pull into extension, it's pulling into an anterior rotation, pushing into a posterior rotation, and then we got to do both. Okay? And then go ahead and flip. Right? And remember, you need 3 out of 5. Right? So, a little hint. Right? The sacral thrust. One hand on top of the sacrum. The other hand on top of that. Press down, bounce. Yes. So, if you have to do Lazarus cluster in your practical, I would make sure sacral thrust is one of them. Right?
Just keep it simple.
Keep it simple. Right? Thrust the sacrum, ASI gap, ASI's compression, 3 out of 5, run away. Right? That's it. Right?
You get to 3 out of 5, you just, you're like, I'm not even
I don't need the other two.
So you're
right?
looking for pain provocation now.
But if you don't know the cluster, if you don't know you need 3 out of 5, then I'm gonna make sure you're doing that thigh thrust, because that's all sorts of, if you ever practice it, you're gonna jack that up. Right? So again, in a practical situation, don't get cute. Pick the easy ones. 100%.
Yeah.
Right? So that's Lazarus cluster, ASI's gap, ASI's compression, thigh thrust, sacral thrust, and then Gaenslen's both sides.
Cool.
Right? So let's go ahead and let's break and let's do those.